2008 was a tough year for us in terms of revenue growth, but we did a lot of things that will make us stronger in 2009. Reduced our cost structure. We focused very much on cash flow. Our cash flow was excellent. And we have a number of very exciting products to launch. And plus, our business is global. It's not so much dependent on large capital budgets of our customers because we have mostly consumables. So I think Millipore will grow in 2009 and will stand out as one of the strong companies in this economy. Advancing life science together means that we're working very closely with our customers to help solve their problems. And that could be in biopharmaceutical production, where we develop new tools, new services, new ways to make the whole production process of life-saving biopharmaceuticals much simpler, easier, faster, and also more accessible. Or on the research side, there are many of our researchers working on breakthrough scientific insights, and what we do, we help them to advance that, and that is exciting to see. Millipore differentiates itself by offering innovative products, very deep application know-how, and very good service around the world. I'm sitting right now in a facility here in the United States that we will replicate, or we have replicated, in Asia. That helps our customers to train their people, helps them to do scale-up experiments, so they can have exactly the same process operating in that country. That's one of the advantages that we bring. Our brand is a premium brand, and it stands for trust and innovation, and we deliver it through the commitment of our people on a daily basis. So in the end, the edge we have is the Millipore people. We are driving and managing innovation at Millipore as the #1 priority. Our customers are innovators, we have to be innovators too, to help them to drive innovation forward. We have our own research development effort, where we take in our core technologies and developing solutions for our customers. We're buying innovative companies and bring them into our development process and into our global distribution system. And we're licensing much more, and we're partnering much more with smaller companies, smaller innovative companies, to get their products to the market. Innovation is our #1 priority. Innovation drives growth. One of the things that excites me in our bioscience business is that we have transformed the business, and we're now in very, very interesting scientific fields. So, for example, we are selling tools and products and solutions for stem cell research. Now, stem cell research could be the next wave in biotech. We're providing tools and solutions for that research area so that researchers who are working on curing diseases that are incurable today with stem cell technology. And we are making a contribution by bringing our tools to scientists to work on these cures. That is exciting, and that's a sign of the transformation of bioscience.
International markets are hugely important to the future of Millipore. 65% of our business is outside the United States today, and that number is growing every year. Particularly in markets like Brazil, Russia, India, and China. Those markets are growing at a multiple of what the markets in North America and Europe grow at. It's important to be there early, but more importantly, it's important to be close to the customer. Millipore's model has a lot to do with customer intimacy, and the more time we can spend with customers to help them with their problems, the more successful we're going to be.
Sustainability is a business mandate in my view, and we have to find ways to run companies with less impact on the environment. That means primarily reducing the greenhouse gas emission, but also reducing our dependency on oil. Our goal to reduce our carbon footprint was a 20% reduction in 5 years, and we are well ahead of this goal. It's become a grassroots initiative where lots of people, lots of different sites in the company actually embraced it very, very actively. My wish is and my hope is that other companies will follow on a voluntary basis so that we have overall an impact on this major, major global problem.
Millipore over the last couple of years has worked very hard to improve the operations of the company, partly because we intend to lead the industry in manufacturing effectiveness and quality, but also because that has benefits to the bottom line. Over the last 2 years, we've announced 2 different supply chain initiatives, and through those, we've consolidated our manufacturing footprint, increased the efficiency of our operations, and improved the quality of our products. The challenges of human health never end, and our customers are committed to finding new cures and therapies. We're committed to helping them do that. When we think about value creation for stakeholders, we think first about shareholder value, and we do that by driving growth, profitability, and cash flow of the company. Of course, we can only do that if we are also creating value for our customers, and that in turn creates opportunities for our employees. Millipore is truly a portfolio of many businesses and many products in many markets, and so we have the opportunities to invest selectively in the areas that represent the most growth. Right now for us, that includes the drug discovery business, aspects of the life science business, disposable manufacturing and bioprocess, and certainly our business operations in Asia.
The current economic outlook is not the best, we all know that, but I am convinced that we will weather this storm very well. We're well positioned to do it. And I'm not pessimistic on 2009 at all. We have slower growing markets, but we will grow faster than the market. And that is in itself exciting because it is a challenge. More longer term, I'm really energized by the mission to drive growth through innovation. There are fields that we're engaged now that are extremely exciting, and they excite me because they can make really a difference in the life of our researchers and in our pursuit of finding new medicines that cure incurable diseases.